The healthcare industry again backed down Democrats at the state capitol who wanted to create a government-controlled public option for health insurance. It was watered down once more in a bill that was also promising some other changes to insurance designed to improve care for underserved communities and to save all Coloradans money. Anusha Roy looks at whether the bill in its current form can still deliver on those promises.
Advocates for House Bill 21-1232 were clear this morning.
Have the ability to participate in the system so we don't die like flies, like we are dying right now in the middle of a freaking pandemic. That's the reality.
And the Colorado option will be expanding access to people who are undocumented.
It would create a standardized health insurance plan that insurance companies would have to offer across the state, with important promises of being more affordable, reaching more minority, rural communities, lower income families, and small businesses.
The plan is going to be designed alongside people of color.
For those who have insurance through their employer currently or get their insurance through Medicare or Medicaid, this bill is not going to impact them. But there's a certain percentage of Coloradans who are being really squeezed by high health insurance costs.
Around 15% of the insurance marketplace could buy in. That adds up to around 466,000 Coloradans. But the promises are riding on a plan that has yet to be written. And the Colorado Association of Health Plans is worried about realistically meeting goals, the amount of authority granted to the Division of Insurance, and cost shifting.
We got it to a reasonable place where the price reductions are modest, but they will be significant for people who are struggling to afford insurance.
Just looking at all of the underlined and highlighted changes shows just how much this bill has morphed.
Physicians are begging to be empowered.
The Colorado Medical Society switched from being against the bill to neutral, and after an amendment that would allow physician groups to opt in or out of accepting the proposed insurance plan versus making it mandatory with penalties. They say they are all about quality, affordable health care, but wanted more flexibility.
Physicians take Medicare and take Medicaid, and this bill, pays above Medicare.
When we were talking to the Colorado Medical Society, they said they're kind of in this wait and see mode, right? If this bill does pass and what that insurance plan ultimately looks like, that's when they're going to be able to tell how access is changing for rural communities and for the underserved communities. And a big component of this is going to be enforcement. So what happens if an insurance company doesn't actually meet all of the requirements? Well, the plan right now is for the state to step in and start working with them to make sure that what was promised in the bill is actually what people are going to benefit from. They're hoping to get all of that sorted out before any of these insurance plans would be opened up to the public by 2023. Of course, Kyle, the very first step is that this is now heading back to the House. There's some Senate changes that they have to go over and then seeing where the bill goes from there.
And Anusha, I think when I think about racial disparities in healthcare outcomes, one of the first things that jumps to mind is maternal mortality. Like across America, that continues to be a really big issue.
Yeah, and we were asking throughout the day, right? So specifically, what is happening within this bill that is going to be addressing those kinds of disparities? And there's actually language in it where they want to address prenatal care and make it more affordable because maternal mortality, it's impacting minority women at a disproportionate rate across the country. We're seeing that same trend in Colorado. So, as they're working on this, if this passes, one of the things they want to get to is how do you make that affordable and get people in for their appointments?
All right. Anusha, thank you very much.